much. Hopefully you guys can see me. Today, we're going to talk a little bit about some work that my team and I have been doing for the past little while. It was a big focus of a lot of our work for a period of time, predominantly led by a previous PhD student of mine who's now graduated and gone on to have a fantastic career. Her name was Alyssa, and she did a lot of work with and involving the Cine Family Foundation a couple of years ago. And this whole project around bullying started because she was doing some work with some of the people that were attending Cine and the Ability Hub to try and get some supports. And she happened to observe a lot of them talking about their experience of being victimized and bullied when they're at school. And so this kind of piqued her interest about kind of the overlap and the relation between bullying and autism. And then about a week or so later, she said she was observing the same group of individuals who had disclosed being victims of bullying at one point in time in their lives, bullying somebody else who was there to receive services or kind of picking on them. And she kind of got intrigued by this possibility that people could be both victims and also potentially bullying, and what are the social implications of this and how and why it happens. And she went to look at the research and found that this was an area that was starting to emerge, but that there wasn't a lot of work around that. And so she approached me and said, this is what I want to do for my dissertation. I want to take a look at bullying and autism. And I said, let's do it. And so we were able to secure a healthy amount of research funding from SSHRC. You see the logo at the bottom of the first slide here. That allowed us to take a look at some things and collaborate with a couple of people that I'm really fortunate to try and work with overall. So what I thought we would do to start off with is just focus on what bullying is. First, how is it defined? What exactly is it? How often it happens? The different forms of bullying, and all the complications that we have to try and identify exactly what bullying is and how frequently it might happen. We'll talk a lot about the impact that victimization and perpetration can have, and then we'll transition over and we'll talk about all this sort of stuff in relation to autism. And then once we get through that, I'll turn to some strategies that have been identified in the literature and in clinical practice around what we can do about all this sort of thing. And I'll put forth right now that I don't have the silver bullet to try and get rid of bullying of anybody, much less bullying of those who are on the spectrum. And I certainly don't have the cure-all and the be-all and end-all about how we can try and work with this sort of thing. But there are a lot of resources and strategies that are out there. And so we'll go through what we do know and the things that we have found to be at least somewhat effective. And we'll talk about, of course, those limitations and things that are going to happen as a result of all that. So just to kind of delve into it and talk about what bullying is, it's been around for a long time. It really started to pick up in terms of a research focus in the 1990s. And the person that's been credited with really starting this whole movement is a guy by the name of Dan Olfeus. And he was in Norway. And in the 1970s, he started what we are aware of as the first kind of research project to look at bullying. That's because there was an incident in Oslo where there were 3 children who had experienced a lot of bullying, all committed suicide in a very short period of time. And so the government in Norway decided this was something they really wanted to take a look at. They didn't want that to happen to other potential children. And so they commissioned Dan to take a look at this, and he's been very prolific in his work, and a lot of the information we know about bullying today has come from a lot of his work. So what we needed to try and do initially was define what we want to consider bullying, because there's a lot of things that are kind of similar to bullying, but bullying tends to take on something that's unique and different. And a lot of different researchers, a lot of different programs, a lot of different organizations that work with and take a look at bullying have subtle differences in how they might define it. But one of the most common ways we take a look at it is an aggressive act that can be demonstrated through various different ways, and we'll talk about what those different ways are, that occur within a relationship between different people. So bullying is not something that we typically do to random strangers. Bullying is typically done to something that we have some sort of personal connection with, or we see kind of on a more ongoing basis. It also involves a power imbalance. So that means that there is somebody that seems to be more powerful than another, or is trying to situate themselves to be more powerful than the other. And the act of bullying is an attempt to try and put that other person lower in a power hierarchy. So it's an attempt to try and adjust this power dynamic, often within a social relationship, so that one person is put down and the other person gets moved up this social hierarchy. It also has an intention. The perpetrator needs to intend to try and cause this power differential. It's not an accidental behavior. And it is something that's repeated over time. So it's not just a one-off situation. It's something that happens repetitively. And one of the things that we look for is the form of bullying. And then one of the really strong indicators of impact of bullying is how often it happens. So this is a daily thing, a weekly thing, a monthly thing. More frequent it happens, then the more impactful it can be. So there's a lot of complexities that go on with this. And we're trying to differentiate what we would consider bullying from, kids being kids, and sometimes we tease each other. That's not the same thing as bullying. Just like that one-off aggressive act or that fight that two children might have one day to school, these things are all different than what we typically consider bullying, with that repetitive act, with the intention to adjust the social or the power imbalance to try and harm somebody so they move down and that you move up. Another term you'll often hear, and I'll use it a lot throughout this presentation, is called peer victimization as opposed to bullying. We try and use that term to recognize that one person is a victim, and this bullying typically occurs between peers. It's very rare that you see people from different age groups or different demographics engaging in this sort of thing. Peers are the most common bullies and victims, and that's because it's within your peer group that you'll have the most impact to try and have an adjustment to the social hierarchy. So you'll often see that kind of terminology used. So there are different kinds of bullying. We've got physical, so actual physical aggression towards somebody else. We've got verbal, which would be aggression with words and with names. Social, so spreading rumors about other people or kind of telling stories that get propagated kind of throughout the social network that the situation might happen within. More recently, we've got electronic bullying, and so that could be through Facebook, through Twitter, through Instagram, through random emails, through texting, any way that a person can receive an electronic message. There's also racial bullying, as that has to do with particular cultural traditions or ethnic backgrounds. There's now sexual aggression and bullying as well, where there could be, it's kind of an aspect of verbal, but it's a targeted aspect of verbal, where they're trying to talk about somebody's sexual behaviors, somebody's sexual preferences, somebody's sexual activities, and trying to use that to cause harm and trying to adjust balance. And then another new one that we're focusing a lot on is disability bullying. And so that's usually through one of these other means, but targeting the behaviors at some aspect of disability. And as you can appreciate, there are a lot of different forms, and the evolution of the forms tends to happen, where you tend to see that younger children often engage in one form of bullying, and as they grow older, if they continue to engage in this pattern of behavior, the form changes. And so I think I'll talk later on about how younger children typically engage in more physical forms of bullying. And as they grow older, they tend to move away from that and tend to engage in other forms of bullying, typically because they start to realize that if I spread a rumor about somebody, that can have just as much impact on this power imbalance. And the victim doesn't often know who started the rumor. And so it can become a more covert action. And once people understand that they can have this power imbalance without actually being caught, as opposed to physical bullying, where there's actual, like, people can observe physical activity, sometimes that transition over into this more covert form of bullying makes it much more successful and much more long lasting. We also want to talk about how often it happens. And so there's a lot of factors that go into our understanding about how often bullying can happen. So part of that is knowing what it is we're defining bullying as, because if different researchers who are investigating this have different definitions of bullying, naturally they're going to have different metrics of how frequent it is. It also depends upon the modality. So if one researcher is only looking at physical or verbal or social, and another one is being more all-encompassing, then naturally they're going to have different metrics of frequency. Also depends on who we're asking about this sort of thing. And so are we asking people who are potentially victims how often this happens, and the form of which it happens? Are we asking teachers? Are we asking perpetrators? Are we asking parents? A lot of these things can have an influence on the metrics that we get at. And so you find in the research literature, when it comes to bullying, there's a lot of inconsistency in descriptions of how frequent it happens, on the modality of which it happens, the definition of which it happens, and this leads to a lot of challenges when it comes to research, particularly when we're doing the work that we had done with the spectrum, in that it's sometimes challenging for parents to know whether or not their child is being bullied, because the child may or may not communicate that to the parents, so the parents may not actually know. The teachers may or may not actually know, because if the bullies, the perpetrators, are more socially savvy, they tend to do it in ways that aren't overtly visible to teachers. They're not going to start hitting children on the playground. They'll spread rumors behind the scenes, or they'll do electronic bullying that happens through Facebook or Twitter that teachers can't actually see. So sometimes teachers aren't exactly the best observers and reporters of this sort of thing. And same thing will self-report. A lot of time, especially younger children or children who might be more severely affected by autism, may or may not be able to understand that they're being bullied, or may or may not be able to communicate the behaviors they're experiencing. So we've got challenges across all of these raters in understanding really how often it happens. We do have some metrics about this, and I'll talk about the general population of bullying and then focus on the autism community more specifically when we get to that part of thing. But just to understand that it doesn't matter which kind of demographic we're talking about, we're likely underestimating the actual frequency of bullying because we know that there are challenges around all this sort of thing. So we do know that bullying is actually much more common than most people understand, and actually much more common than people would like it to happen. There's a very large study that was conducted by the World Health Organization in 2009. It had over 134,000 people across a variety of different countries. They took a look at specific age bands because if you go beyond these age bands, now the sample size becomes dramatically larger and it becomes a lot more difficult to manage all that data. But within this particular age band with that very large sample of children, they found that a third of those kids said that they had been a victim of bullying at least once or twice during the current academic school semester they were in, and 2 or more times within the month that they completed the survey, which means that 33% of these children are experiencing at least occasional victimization from their peers, and 10% of this overall sample said that they experienced it quite frequently, so every day or at least multiple times a week, which is quite a lot of kids and a lot of things that are going on that prior to the study, we didn't really understand that it was as prominent a particular situation. In Canada, there's a fantastic program, an organization we'll talk about a little bit later on called PrevNet, and they've done a lot of work with bullying and anti-bullying strategies within this country specifically. They did a study a little while ago that showed within our country that 12.3% of students self-reported as being a victim of bullying at least 2 times within the past month. And again, there is likely an underestimate there because there are going to be children that will not feel comfortable disclosing that or that weren't part of this particular survey or study. And so we're capturing only those kids that happen to complete this and maybe even at school on the day that the survey was happening. So we can understand it actually happens quite a lot. And once we understand the impact of what bullying can have, this proportion of children experiencing something that can have a pretty dramatic impact on their social functioning and on their academic functioning well into adulthood becomes a pretty prominent problem that we have to try and work through. There's also people that have taken a look at how often the different kinds of bullying occur. And so you can see what they found. It was a little while ago this research happened, so things are probably going to have changed since then. But you can see that physical bullying, so hitting, kicking, punching, stuff like that happened about 13% of the time. And it was verbal and social bullying that was reported the most. And again, I talked about that a little bit ago, that a lot of children realize that verbal and social bullying can be just as effective as physical bullying in terms of trying to adjust that social hierarchy, but that you're often a little bit more covert or hidden as being the person that's starting the rumor or that's telling these lies and things like that. So once kids start to understand the power and the strength of more covert forms of this bullying behavior is when it really starts to pick up. At this point in time, electronic bullying was only about 10%, but we now know that that's likely quite a lot more than that. There just isn't any newer metrics of electronic bullying, but I'm going to say it's probably at least doubled. You can appreciate just how often, texts can come your way or Facebook posts. I know that there are even some pretty prolific news stories about like Facebook hate groups that are put up around specific kids. The dramatic impact that all that sort of stuff can happen on children can be pretty prominent. The other thing I want to take a look at is what might lead a child to become a victim of bullying. What is it that seems to target that this is somebody that could be picked on as a victim, that could be a suitable person to try and move down that hierarchy? And there are particular things that research has shown. It's important to understand that in order for a bully to get what they want out of this, there has to be a target that enables them to get somewhere. And so there's going to be a little bit of stuff around that that's going to be really important for us to understand. So things that we do know is that people who are more withdrawn or anxious tend to be more obvious victims of bullying. They tend to get picked on a little bit more frequently than those who are more socially connected or those who seem to have more intact mental health issues. People that have more complete and more complex social networks tend to be more saved from bullying, whereas people that are more isolated or those that struggle with the social interactions and therefore have friends that can help stand up for them tend to be more frequent victims. Individuals that have negative self-thoughts that tend to think that, you know, I deserve this sort of behavior, they tend to be identified and victimized a little bit more often. Children that struggle to reason through how to deal with situations like this. So if somebody is picked on and they can determine an effective way to address that problem, they're less likely to get victimized later in life. But children that struggle to understand that sort of thing tend to get victimized more often and more recurrent because bullies realize that this kid can't really understand how to deal with that. And so they start to get picked on more commonly. Kids that have experienced challenges in their life, so community issues, family issues, or school issues, again, bullies tend to see those kids and think that's a person that can help me navigate the social network. And individuals who have smaller peer networks or those who are more isolated from their peers tend to have more victimization. And as you can see, the things that I put stars by are things that typically those who are on the autism spectrum often experience. They sometimes are more withdrawn. They a lot of the time have a lot more anxiety or mental health issues. They struggle with social interactions. They have smaller peer networks, or sometimes they struggle with the peer interactions. And so these are kind of predictors that somebody on the spectrum could experience this a lot more common than people that come from other groups around the school. And so it's a thing that we really wanted to focus on. When it came to the study that we did, the way we structured it is to understand that being a victim of bullying can have a lot of dramatic negative impacts that we'll talk about in a little bit here, and that there's at least one particular population that seems to experience a lot of risk factors through being a victim of bullying. And there's a lot of literature that kind of spoke to that already that I'll cover in a little bit of time here. What we wanted to take a look at is what particular risk factors might be helpful for us to understand whether or not somebody who's on the spectrum is more likely to be a target of bullying. Because if we understand what some of those unique specific risk factors are, we can then try and address support programs around them to try and build some support systems so that hopefully children won't end up becoming victims the way they more commonly happen to be. It's also important to understand the different places in the bully-victim relationship that can happen. And so there's the victim, and then there's the bully, or sometimes called the perpetrator, and then there's somebody who can fill both roles at different points in time. So there might be a victim from one individual, but then because they get pushed down the social hierarchy in this particular relationship, they often try and find somebody else to push down the social hierarchy so they can go up. So they're trying to balance this kind of push-pull. And depending upon which role you happen to be in, there are a lot of negative consequences between all this sort of stuff, right? So we tend to find that there's a lot more emotional pain if you're a victim. And if you are a perpetrator, I bet the bullies try to think that there's nothing negative they experience because they're getting that positive social hierarchy kick up. Whereas we tend to focus on a lot of the impact of the experience of being a victim. We do know a lot about that. We'll talk about the bully stuff in a second here. So we do know that being a victim causes sometimes physical pain, depending upon the form of bullying, but there's a lot of emotional pain that can happen. And we do know from research that it's the emotional pain that often has a much more long-lasting impact. It can be much more severe, especially if it's repeated over time. We start to get more long-lasting negative impacts of these sort of things. So there is a lot of research to show that kids who are more chronic victims of bullying tend to start to avoid school, and as a result tend to start struggling with their academics. And then that can lead to a lot of impact later in life. If their academic performance starts to go down, then you've got impact on independent transition to adulthood. You've got challenges around transition into post-secondary education, around transition into vocational opportunities. So this link between being a victim and academic achievement can have a lot of impact. They've also got a lot of physical symptoms. So it's not just they might experience like the physical impact of hitting, kicking, that sort of thing. But a lot of kids, if they have to go to school and they experience bullying within that environment fairly commonly, they start to get physical sensations just in anticipation of going to school. So you start to have a lot of kids that will have a lot of headaches, body aches, stomach aches, will have a lot of throwing up, they'll have a lot of these physical symptoms just in anticipation of going to this particular situation where they're going to experience a lot of that emotional pain, so that it transitions over from just emotional into physical pain as well. We also know that mental health is very prominently impacted by all this sort of stuff. And there's a lot of research to show that suicidal ideation is really picked up quite a lot by children who experience fairly chronic bullying. So that could even transition over into post-traumatic stress disorder, PTSD, where you have children who've experienced a long-term sequence of bullying, potentially from multiple different perpetrators, end up having these very traumatic experiences and having very prominent negative mental health impacts as they transition to adulthood. They can sometimes last even a lifetime. So we know that there is a lot of issues from being a victim, and we want to try and understand what we can do to either eliminate this or to try and reduce the impact. Those are kind of the two strategies we're trying to take a look at. We also know that bullies themselves aren't exactly immune to this sort of thing, and the bullies, like I said, probably wish and think that they have some ability to kind of bypass all the negative impacts, but we do have a lot of literature to show that by being a bully and by being a successful bully and having a navigation towards that social hierarchy, what you end up doing is establishing this framework of interaction where you start to learn that manipulation of other people, physical aggression towards other people, social aggression towards other people can serve your own needs. And so rather than engaging in effective problem solving, effective collaboration with other people, you tend to start to get into this pattern of more aggressive interactions with the people. And as you transition into adulthood, you try and go into the workforce, you're trying to go into other aspects of your life, this pattern of negative aggressive behavior can start to spill over into your personal life, into your vocational life, and it can have a lot of negative impact in how well your personal relationships can play forth, how well your employment can play forth, and you end up seeing a lot of personal relationship breakdowns, a lot of repetitive employment challenges, because bullies often don't really develop this effective way to work collaboratively with other people. So there is a lot of impact there. And then the one person that tends to get the worst end of both deals are the people who are bully victims, because they experience a lot of the negative mental health and other issues from being a victim. And they also establish these maladaptive patterns of behavior when they're trying to work in particular social relationships to try and overcome these negative mental health challenges. So they've got both ends, and you'll often find that kids who are victims try and find opportunities to get themselves out of that situation by then victimizing somebody else. And so we want to try and make sure we understand the overlap in the relation between victim bullying and bully victim, so that we understand what we can try and do to stop that cycle from happening. Just in terms of what's going on, yes, I will be sending the slides out, and they should be going to everybody. There's a ton of research, to get to Nina's question, there's a ton of research on bullying. I was trying to find, for integration of this one into this presentation, articles that spoke to the biggest picture, articles that spoke to very clearly well-defined patterns of behavior. There is a lot of literature that's more recent than some of the things that I've mentioned here, but the definitions are inconsistent, and so trying to compare and contrast what some people have said versus what other people have said becomes challenging. I'm trying to take a look at rates of particular patterns of behavior become challenging. The stuff that I'm talking about here is typically defined around the most common understanding of bullying, and so the numbers and metrics we have here tend to be the ones that are the most easily understood and represented. Right? So hopefully that is helpful for all that. So hopefully that kind of paints a bit of a landscape around what bullying is. It's social behavior that happens with an intention to harm somebody else through various different means in order to try and adjust this social hierarchy or the social network. So one person could go up and the other person can go down. We also know that it's a lot more common than we would hope, and that a lot of people understand and expect, and that younger children and often boys tend to engage in more physical bullying, and then typically girls and older individuals into adolescence move away from the physical bullying and transition over into the more social covert forms of bullying, which can often be just as impactful and quite negative experience. So we've already talked a little bit about some of the risk factors of bullying and how those on the spectrum can experience those as well. There was a lot of literature that shows, proud of the work that my team and I did, that individuals on the autism spectrum seem to be particularly vulnerable to peer victimization. There's a couple of articles that talked about 1 to 1.5 times more likely than allistic students. If you're not familiar with that term, it's a fairly new term that refers to a non-autistic individual. And then there's other research that showed up to 4 times more likely are individuals on the spectrum experiencing victimization. So if you've got like 10% of individuals experience chronic victimization, we got up to 40% of people on the spectrum will report or will experience chronic victimization, which if you understand the negative impact of it, 40% of an entire community of people, that's a dramatically bigger situation. There's also a lot of literature to talk about the frequency. So it's not just, do you do it, do you experience victimization once a month? It's that people on the spectrum tend to experience it more often and more frequently. And so we now have this double compounding issue where we're trying to take a look at what we can do in order to help identify these individuals and then try and develop some supports around them. Another piece of literature comes out, and there's going to be ways to try and phrase this, and I understand that how I phrase it may irk a couple of people, but I'll just say that individuals who are described as having a milder presentation of autism, and take that however you want to kind of interpret that. The literature uses much more negative terminology than that. So individuals who present with less obvious or less pronounced impact of autism tend to actually experience victimization more frequently than people who are more affected by autism. And the supposition behind that is the more affected somebody is, then the bully, the perpetrator, doesn't get the same sort of social payoff that they might when somebody presents as having much more prominent challenges with the behaviors of autism. They're not as easily seen as somebody to help somebody navigate up the social hierarchy. But somebody who doesn't overtly look like they have a disability, then they tend to be seen as somebody that's fair game. And so you tend to see that the most common victim of perpetration is somebody who is what used to be classified as high functioning, or somebody who is intellectually intact but socially struggles to establish some of those social networks around their school, and is seen to be fair game for being a victim. And so that is the one individual that our study tended to focus on, because we want to try and see what we could do to pick out particular characteristics of the school environment or of particular individuals, and to see what we can try and identify that might allow somebody to get there. We do know within autism specifically that social bullying tends to be the most frequently reported form of bullying. And this is by parents. The challenge is a lot of individuals on the spectrum didn't come forth to fill out the survey, and the survey was done by a bunch of colleagues of mine from Ontario a couple of years ago. But parents were very willing to fill out the survey. And they said that 70% of their children experience some aspect of social bullying, which is even more than the metrics that we had talked about not that long ago. So again, I think even 70% is probably an underestimate, because a lot of parents don't go to the schoolyard and aren't exactly privy to the kind of behavior that their children might be experiencing. So we can understand that verbal and you see physical bullying are reported by parents quite a lot. And again, I think the rate is even higher. Cyberbullying was only 10%, and this was almost 10 years ago now. Again, I'm expecting that the cyberbullying is going to be dramatically higher because of the proliferation of smart technology, websites, Facebook, Twitter, Instagram, all that sort of stuff. All these numbers are probably going to be higher, which makes this an even more dramatic challenge when we're trying to take a look at just how much of a particular community of individuals might be experiencing this sort of thing. We also know that perpetrations of people who are bully victims within autism is also a high risk. So they found that children on the spectrum were up to 4 times more likely to be a bully and or to be a bully victim. So it's not just that they're victimized more often, it's that they also engage in the perpetration or are bully victims as well. And so we have that as a secondary factor to try and take a look at. The potential positive spin on all of that, though, is that there's some nice research to show that the people on the spectrum who were more often perpetrators or bully victims are usually people that had autism and ADHD as well. And it was shown that it was more of the ADHD characteristics as opposed to the autism characteristics that led somebody to be a more common perpetrator or more common bully. So once we kind of accounted for the attention-related concerns, it was shown that people on the spectrum were not more likely to be a bully. It was the attention or kind of the impulse control challenges that tended to lead somebody to be a bully. But we do know that a lot of people on the spectrum also struggle with attention-related concerns. And so this is something we need to be aware of and really make sure that we address, because we want to establish effective collaborative social problem-solving skills in any particular individual, especially people that tend to be more at increased risk for victimization. We do know that people on the spectrum who experience bullying tend to have particular challenges. So they tend to experience a lot more anxiety. And if you know a lot about autism and a lot of the research that's emerging with the past short little while, we now know that just being on the spectrum itself produces a lot of anxiety in somebody. And so being on the spectrum and being a victim dramatically increases the anxiety. So now that's a whole other challenge we're trying to help and support. It's not just the autism and other challenges and academic difficulties that people might experience. Now we've got those the mental health issues that are kind of compounding a lot of that stuff. We need to try and take a look at how we can support and address these things, because this starts to spin out of control very, very quickly. Hyperactivity, self-injurious behaviors, and a lot of other behaviors related towards autism really start to become exacerbated once somebody is a victim. And if these things are already impairing somebody's independent functioning, we don't want to try and exacerbate that any further. Then things, again, spin out of control and become much more difficult to try and work with. So we want to try and find ways we can either stop it or try and work through the process so that the impact of this particular situation doesn't take as much of a strong thing about it. We also know that a lot of people on spectrum, when there is research to give them to talk about their experience of this, they have some very negative self-thoughts, and that can, again, show a lot of negative mental health impact as a result. So they talk about feeling like a freak, they talk about really wanting to be normal or to fit in. And that's a very negative way to try and think. If you're experiencing bullying, if you're a victim because you want to be normal or because you think you're not normal, that's a whole other situation. And we'll talk a little bit more about what is normal and how can somebody not be normal. We don't want somebody to try and position themselves as being atypical or abnormal, and that's why they're experiencing this sort of thing. There's a lot of other factors that have to go into that. That's going to be a strategy we'll talk a little bit more about. We do know that boys have a lot more behavioral difficulties. We know that diagnostically there are a lot more boys that are recognized as being on the spectrum, so there's going to be an overlap between there. We know that there are a lot of children, especially if they're younger, have a lot of school refusal, a lot of behavioral difficulties when they are at school. And being a victim of bullying just increases this all over again. So it compounds and exacerbates a lot of the difficulties and challenges these children can experience. And this is all something we want to try and take a look at. That's why we're going to talk a little bit about what we can do about all this sort of thing. We know that peer victimization is a challenge. We know that it happens more often than we would like. We know that students on the spectrum tend to be a victim of bullying more than other children at the school. And we know that the impact of bullying for this particular community of individuals tends to be more prominent and more negative than other individuals at the school. So knowing all of that, we want to try and do something about it. And really, there are two approaches of things we can try and do. One is what's kind of more broadly classified as an anti-bullying program or strategies to try and stop bullying from happening. And the other one is compensatory strategies. And that is, if bullying is going to happen anyway, what we can do to help individuals kind of cope with this, with being a victim, and strategies we can put in place to help the impact of bullying go down. So of course, we want to try and stop bullying from happening. If we could stop it, we don't have to worry about a lot of the other things. And there's been a ton of different anti-bullying programs that have been developed across decades of different work, implemented using different paradigms, using different people, in control of the program, who are trained around different particular strategies, that sort of stuff. And there's an article that we put out a little while ago to take a look at, we call it a meta-analysis, from taking a look, stepping back and looking at a wide range of literature that all talked about particular bullying programs. We do know that these anti-bullying programs, if predicated or based on particular frameworks, can be very effective. And there's some research to show that between 17 to 23% of these programs tend to really have a strong impact on the frequency and form of bullying within a classroom, within a school environment. So these things do work, but it's 17 to 23%. So it's not 75 to 80 to 90 to 100%. It reduces it, sure, but it only reduces it a small amount, which means depending upon the study and the metric you're looking for, you still got around 80% of bullying that continues to happen, despite the fact that these programs are put in place. We do know that North America tends to be, the anti-bullying programs in North America tend to be less effective than in other places, particularly within Europe. And there's some research to show that it's because historically, people in Europe tended to have clamped down on it quite a bit more strongly. North America, particularly the United States, tended to have a bit more of a laid back, boys be boys kind of an attitude. And so these programs didn't seem to have as dramatic an effect as they did elsewhere. So although we've got between 17 and 23%, if you take a look at North America, these programs aren't that effective. We do know the programs that are effective have a couple of key particular things within them. They involve teachers. Those teachers are trained and they receive formal training on how to help bullies navigate the social situations more effectively, so they don't have to resort to the kind of manipulation techniques that they often do in order to try and get that kind of that social hit, that social bump. They also work with victims around how to try and navigate a situation so that the bully understands the impact that the victim has experienced, and the victim understands how and why the bully did what they did, and they have this collaborative problem-solving approach to try and help this mutual understanding happen so that there can be a repair of relationship as opposed to this ongoing fracturing of relationship. Other things that are make up an effective anti-bullying program are a blanket anti-bullying policy. So school-wide, not negotiable, bullying is not going to happen. And the most common term we hear about this is a zero tolerance policy, which means that if somebody is found to be a bully or a perpetrator, that there is zero tolerance, that there's like expulsion that's put in place around that sort of thing. And if that policy is in place and it is adhered to, there's typically, a bully or two or three that goes through the process and then has to face the consequences, but that other individuals recognize that this particular school has a policy that has particular consequences and that they are willing to adhere to those consequences. And so that's going to be a really important thing we want to try and take a look at as well. Not just relying on teachers, but having other professionals within the school as well provide some support. So sometimes victims feel comfortable approaching a teacher or receiving support from a teacher, and sometimes they don't. And so if we only have teachers who are involved in this program, sometimes that limits some students from the people they can receive some support from. So if there's psychologists or counselors or other individuals within the environment that can be helpful within this, and that's also going to be a support for it. Parent training is going to be helpful, so having parents understand what bullying is, how they can recognize this in their children, and how they can talk to their children about it. If kids aren't telling their parents that this is what's going on at school, parents don't know that this is something they could try and have a role in. They could try and help support their children around. So there's got to be a little bit of shared understanding about that sort of stuff. And then efforts to try and allow people to know that bullying does happen, and potentially you or somebody you know has gone to a school and they say there's no bullying in our school, and that's clearly not the truth. There is a lot of bullying. It just happens in a way that the school administration isn't aware of it. And so we need to not imagine that bullying doesn't happen because a particular school might have a policy. Kids are smart and they'll find a way to try and do it. There still needs to be anti-bullying policies. There still needs to be zero tolerance around that. There just needs to be awareness that it can and will happen, and there must be ways to try and address it and deal with that. We do know that these are factors that enable anti-bullying programs to be effective, but even with all those things in place, they are minimally effective, probably say it best. We do know that they don't stop bullying. Kids just tend to become more savvy with how they do it. They tend to move it off of school property, so the school doesn't have any direct control over this sort of behavior. And the other limitation around the particular topic we're getting to right now is that I think there's like maybe one or two anti-bullying programs that tend to focus on children with disabilities as victims specifically, and or kids with autism. And so there are unique factors. We spent a bit of time talking about that sort of stuff that are at play with the autism community. And if the programs don't understand and address kind of those unique contextual factors, it becomes an additional challenge for that particular community when the programs might not actually benefit or support them. So if we know that anti-bullying programs have some effect if situated in the right way, and if developed and implemented in a certain way, we know they have some impact, but they're not going to eliminate it entirely. So then the other approach we're going to try and take is what we can do about this whole thing. So here we're looking at coping strategies. So if a kid is a victim of bullying, what could they do in response to that to try and help navigate the situation a little bit better? And there are different coping strategies one could implement. We'll talk a little bit about that. There's some skill development that could happen, and then there's some cognitive behavioral approaches that people could implement around this whole thing. So the coping strategies was the one thing that Alyssa, my student, really wanted to focus on. This is what her dissertation really took a look at. So she did as large a study as we possibly could. So across 3 years with 7 different universities across the country, we recruited 90 individuals, 90 students that were on the spectrum, and a teacher and a parent for each one of them. So we kind of had 90 triads. And they each filled out a survey that was developed by PrevNet, and we'll talk a little bit about them later on. that was a survey they developed around incidence and frequency and form of bullying. And so the student filled it out, the parent filled it out, and the teacher filled it out, all in reference to the student. And what we were interested in was a couple of things. One, how often did each one of those raters endorse that the student was a victim? And how much consistency across those three did we get? And you can imagine we didn't get a lot. We also wanted to know, what are the forms of bullying that this student tends to experience? And did that differ based upon age, based upon grade? We want to try and figure that out. And then the one thing that Alyssa was really interested in is those individuals who identify as being a victim. What do they do in terms of coping strategies? If we know that we can't stop bullying, we want to try and figure out what are they doing about it. And if we understand that what they're doing may or may not be all that effective, we then have an avenue to try and figure out what we could do as a strategy to try and help enhance a lot of these coping things. So when it comes to coping strategies, she specifically took a look at the literature and understood that there are two coping strategies that people typically implement when they're exposed to any kind of stressor in life. And those are called approach or avoidance strategies. An approach meaning you lean in to the stressor, you lean into the problem, you do something active to try and address the situation. Avoidance coping things are you lean back, you avoid that particular thing. So if I'm, if I'm getting yelled at by my wife, an approach situation would be I lean into it and I talk to her directly and I try and figure out what it is that I've done wrong. Could be anything. What is it that I could do to try and repair the situation? You know, there's an active problem-solving process going on. An avoidance would be I go sleep in the other room. I try and, recoil and hide, and hopefully my wife calms down before things blow up a little bit too much. And as you can imagine, a lot of people engage in avoidance things because they don't want to experience the individual that's a perpetrator. They want to avoid a lot of that stuff. But a lot of literature shows that it's the approach techniques that tend to be more effective. And so we wanted to figure out, when it comes to the autism community, what are they doing? Are they approaching or avoiding? And if we know that approaching tends to be more effective and they're not doing it, then that's a thing we could try and take a look at doing. Where can teachers go to take these training and anti-bullying management strategy courses? They tend to, individual teachers typically can't do it because you need to have, like, the whole school needs to be involved in this process. So it typically is more of like a principal or even a superintendent school division type of situation. PrevNet will have a lot of information on particular courses and things like that that can be helpful. So when we get the PrevNet later on, there's some links about some stuff that that's hopefully pretty fantastic around that. I would say that social media makes all of this worse. And that's, well, there's a lot of reasons why social media makes our life worse. Can make it better, but certainly had a lot of impact. But I can create any fake Twitter handle I want. I can create any fake Facebook group that I want, or any fake Facebook page, and then I can start sending evil messages to somebody, and you can't do anything about it, because if you happen to block my one, I'll start another one, and I'll start another one, I'll start another one. So I think social media actually exacerbates a lot of this stuff because of the hiddenness that it can bring up. So there's a lot of stuff around electronic bullying and the anonymity that it happens to give people that makes all of this sort of stuff much more dramatic. And there's that story, I think the girl was in Vancouver, where she was cyberbullied severely and then she committed suicide not that long. It was a year or two ago, and it started a very large conversation across the country around what we can do about cyberbullying and all that sort of stuff. So in terms of coping strategies, when we take a look at what people typically do when in the face of bullying, the number one strategy people do is they tell somebody about it. And who you tell and how you tell is very important. Telling your parent doesn't often actually do anything. And that's surprisingly the number one thing that we always tell kids to do is, if you get bullied, you need to tell somebody about it. The problem is telling somebody about it often makes the situation worse, because what you're not doing is actively addressing the situation. You're getting somebody else to address the situation. And all that does is make the bully not victimize you at school. They'll try and do it elsewhere. It upsets the bully, and it's not an active, collaborative, problem-solving approach. It just tends to make the bully even angrier and tends to compound the situation. Unless the person that's told has particular strategies in place and there's policies in place that can help navigate this whole thing, that becomes a challenge. Almost a quarter of people ignore it. And as you can understand and appreciate, I hope, that's also not an effective strategy. If I'm being victimized every day or multiple times throughout the week and I just ignore it, it doesn't make it go away. It ends up giving the bully what they're needing. They're continuing to put me down after a period of time, ignoring this sort of behavior. It takes a toll on me. So we've got two fairly common strategies, one that's approach, one that's ignore, but neither of which tend to be overly effective. And so here's a particular situation we have. We do know that social support is the number one most important thing. And there's a lot of literature and a lot of different avenues to show that just having one friend is the most important predictor of positive social outcome in any child anywhere, forget about the spectrum or not. And so just having one close friend either has an ally with you, so that if somebody is going to pick on you, there's somebody there to either stand up for you or to share that. So it's not just you experiencing the bullying by yourself. Somebody else is either standing it with you, or you have a mutual shared experience. And so it takes a little bit of that stress burden off just by having one close friend. So that's going to be one really important thing that we want to try and build up is, if we can't get bullying to stop, try and enhance the social network. Because as we saw earlier on, having limited social networks tends to identify somebody as being a potential victim. If we can build these social networks, then victimization tends to go down. So that's one thing we try and do. And we do know that, again, approach strategies tend to be more effective if we have the appropriate approach strategy. We want to try and take a look at that. My son is a victim bullied in school. He gets physically hurt 3 times a week in school, lots of bruises. And so, school, what do I do if his teacher does not want to get involved in this and deal with it? Hold on, let me suck it up. I would say go higher up than your principal. So I don't know which school your son attends. I don't know which school system they happen to be in. And just for the sake of privacy, I probably don't want you to tell me. But I would say if that sort of situation is happening and you're not getting satisfaction from the administration at your school, then I would go higher up. Because quite clearly, we all know that this is something that's really important. And if, as a parent, it's something that you need to try and address. So I would go like to the superintendent or like a school trustee. I would go further up, and if need be, I would, access a legal team to try and help you fight this battle, because we know particularly that this is an issue and a challenge, and it can't go on. If you're not getting support from your school administration, you need to find somebody higher up that will give you that support. The other alternative is to engage in what I would consider an avoidance strategy, and that's to withdraw your child from that particular school, go to a different school, or engage in homeschooling. And that's not always an appropriate situation. Some kids on the spectrum thrive within a homeschooling environment for particular reasons, and others don't. So I know a lot of parents that I've worked with clinically have engaged in a homeschool situation for their children because of this particular challenge they've experienced. It doesn't mean that it's most effective, and it puts the burden of education on you as opposed to the school system, and your children should be safe at school. If that's a situation, I would encourage you to do everything that you could to try and address within the school environment, so that you don't have to try and experience that sort of stuff. So one thing that we looked at were the coping strategies. And so you see, this is the first cover of Alyssa's paper that she put out that kind of came from her thesis. What we did with that particular study was we had some students that are on the spectrum, and they viewed a cartoon that PrevNet put out that had several cartoons that had an individual who was a victim of bullying. And what we had the participants do was take a look at these cartoons and then describe the particular strategies that they think would be the most effective in each of these different situations. And so there was a cartoon where somebody was physically bullied, another one where they were verbally bullied, another one where they were socially bullied, that sort of thing. And so we asked them, what should this character do in order to try and deal with the situation? We wanted to try and figure out how aware are they of particular coping strategies, and what would they actually implement if they were this character and this was something they experienced at school. What we got from that whole study is that the participants understood that bullying is a complex behavior that doesn't just arise because of one thing. There are a lot of factors that go into how and when and why somebody might bully somebody else, and that a simple solution isn't always the best solution. So there was actually some good awareness around that was very helpful and insightful for us to understand. They also were aware that particular strategies, and some of them spoke quite clearly to the fact that if I did this, it would make it worse. And a lot of research shows that you're very correct. If you do this, it will make it worse. So there is almost a presumption that people on the spectrum might be socially unaware of what some of the more appropriate strategies might be and what the complexity of this kind of social power struggle could be. And they actually, the participants we worked with were very aware of all these sorts of factors and understood the complexity about it. So they understood that this is what not to do, or that this is not an effective thing, but what they didn't know is what would be the effective thing. And so that was an area of strategy that we could try and take a look at, is they understand that this won't help, but what they couldn't clearly say is that this would help. And so that's where we're trying to take some of these coping strategy, the literature, and try and develop a potential opportunity to try and develop those effective coping strategies in place. So we do know that enhancing particular skills is going to be another thing. So there's coping strategies, and then enhancing particular skills is going to be something that's really important. So we do know that having a social network, having friends is going to be really important, just to reduce the frequency and impact of bullying, but also around mental health and having a fun, successful, enjoyable school experience. So there are there's a lot of direction from the research literature to say that we need to enhance the social ability of people on the spectrum so that they're better able to fit in with the social hierarchy and the social structure. I'll say, sure, there is all that, but listening to the voices of the autism community is also really important. And there's a sizable number of that community that says that, why do I have to change who I am to fit with that group? Why can't they just accept me for who I am and not victimize me because I happen to be unique and different from them? So there's a bit of I think, an emerging understanding of this middle ground that has to happen, that it's not just that people on the spectrum have to develop skills so they can fit in better. There has to be an awareness that the general population has to accept people on the spectrum a lot more easily, so that there is at least a meeting in the middle, and I hope eventually more of an acceptance, rather than there's more movement from the general population than there is from the autism community around that sort of thing. So if people are interested in learning, developing their social abilities and social skills, certainly that's something that can be done. I and a lot of other people provide some social intervention programs that can be very helpful. But I know that a lot of people on the spectrum aren't comfortable with that particular approach, and they don't want to have their social ability interfered with. They are who they are, they're happy with who they are, and all they want is to be accepted. And if we could accept them for who they are, then victimization would go down dramatically and they wouldn't have all this sort of stuff. So there has to be a lot of effort around integration and inclusion, rather than requiring change on the part of the spectrum. And so we also know that establishing a peer group is going to be really important. So we talked a little bit about that. Some things that can help there are, sure, social intervention and social skills training and all that sort of stuff. But a lot of stuff can be, working with kids very early in the grades and trying to allow them to understand that, yes, in your classroom, there are children that are unique and different from you because of physical characteristics you might be able to see, and because of psychological or emotional characteristics that you can't see. And once we start to understand that everybody is different and that there's no reason why we need to isolate or push people aside, we could all just come together and still accept one another, that can be a very effective thing, not just for the autism community, but for any community. And so we'll talk a little bit more about that going on down the line. We really want to try and help children establish a peer group and help enhance inclusion within these kind of school environments. That will really push things a very long way. Making sure that we try and educate teachers and other support staff, both around what bullying is, strategies that can help it, implementation of effective policies and programs, but then particularly how they interact with and include and accept kids on the spectrum. And how can I say this without ruffling feathers? I am in a program, an academic program right now, that I know does not have any formal training for brand new teachers going out into the world on how to deal with children who are exceptionally different. None of them. Most teacher preparation programs tend to teach teachers how to teach to the center of the group. They tend not to teach them how to work with kids that are at the ends of the group or like at the unique outsides of the group. And so you've got teachers that don't necessarily have that skill set, and they go into classrooms, and their classrooms involve kids that are very diverse and wide ranging. And when they don't have the skill set to try and navigate that, they can't model effective inclusive practices as well. There's a lot of effort to try and have inclusion, but not a lot of training on how to make it happen. And so that's another thing. There's working with these kids and those kids, but also working with school staff to try and help them model effective inclusion, effective incorporation, that sort of stuff. So we can try and work at it from the bottom up and also from the top down. And then having a culture and a climate of acceptance. Again, it's not just one particular community we're trying to accept and try and target. Certainly, those who are on the spectrum experience a lot more bullying and they have a lot more impact of it. But there are a lot of other kids that have that as well. And so the strategies that might be effective for the autism community are also going to be effective for a lot of other children as well. And so that's a bigger picture school climate situation we want to try and address and take a look at. Yeah, there are a lot of workplaces that have that sort of stuff and not a lot do. And it is something that's developing over time. We know that there are a lot of efforts to try and make that happen. And if and when Shane is able to get up here, I mean, him and the Sydney Foundation and a lot of other agencies and programs around just our city, much less other cities, that's almost their mission in life, is to try and push this agenda of inclusion and incorporation. And there's slow progress, but it's unfortunately slow. And so we're trying to speed that up a little bit more and trying to do things that we can try and do. And then another thing that we can do is try and build a life outside of school. And so if school is a very stressful, challenging place, either because academically or because of the stress or because that is where the victimization happens, okay, then we can try and build whatever supports within that environment possible. We also want to make sure that there is a very successful life that's a positive experience outside of that environment. That way you don't have, I have a tense, stressful day at school and then I go home and I have to do homework all night. And then I really don't have anything in my life that is positive. I don't have any kind of fun. I don't have anything where I can be who I am. I can enjoy what I'm good at, that sort of stuff. So we want to try and find out what do kids enjoy, what are they good at, and help them to build a positive experience around that so that at least some aspect of their life doesn't involve a lot of this negativity, that sort of stuff. Also, effective nutrition, effective sleep hygiene, developing collaborative social problem solving skills can be very helpful. Often the use of social stories with kids in the spectrum can be a helpful way to help them understand what could I say or do in the context of bullying or establishing friendships or dealing with academic or mental health stresses at school. These things can often be helpful. And then trying to develop peer networks around them. Again, if they have just one friend, it can be a very effective strategy. So trying to develop a lot of that sort of social connection so that there's at least a shared burden, if not somebody that's willing to stand up and defend this person from being victimized. And that really goes a long way. In terms of particular resources, there are a lot of great websites and organizations around the country. The first one that I'll mention, and probably the best one, is this one called PrevNet. And it was started by a couple of researchers in Ontario who took to the task of identifying frequency and rates of bullying in Canada. And they've set up an entire online network of information about bullying, resources for bullying, all that sort of stuff. And so if you're looking for like the Canadian place to go around anti-bullying stuff, information about bullying, PrevNet is the single place to go. After that, there's another agency called Bullying Canada. And again, there's a lot of other information. They tend to share a lot of information with, and they get a lot of information from PrevNet. So PrevNet tends to be kind of like the source material for a lot of this stuff. Autism Speaks can be a bit of a polarizing agency. Some really appreciate and enjoy the work that Autism Speaks do. A lot of people on the spectrum resist Autism Speaks and kind of the philosophical approach they have. So depending upon where you stand on that, you may or may not want to explore those resources, but they do also have some information about that. And so there's a link there that, again, when I hand these slides out, you'll be able to get there. There's another organization from Australia called Bullying No Way. And they've got some really good policies and strategies and approaches for what could be done within a classroom or a school-wide environment to try and help bullying. The National Autistic Society in the UK is a very prominent program in the UK, and they've also got a whole bunch of information about bullying and that sort of stuff. So I'll leave this slide up just for a little bit because the next bunch is just all of the articles and nonsense that I included in. So if you're interested in places you could go to get further information, these be the places. And again, I'll send these slides out and you'll be able to get a hold of all this sort of stuff later on. Do I know why they're anti-Autism Speaks? Yes, and it's exactly why I said it, because the foundation of Autism Speaks, they've had a lot of work and effort directed towards curing autism. And that's, one of the founding organizations was called Cure Autism Now. And a lot of people on the spectrum strongly advocate that their autism is not something that needs to be cured. It's part of who they are. And so they actively resist, the framework that Autism Speaks putting out about that they are something that needs to be cured. And it's a personal perspective around that.
Hi there. Thank you, Adam. Fantastic presentation. It's such I think, a gripping topic, but heartbreaking. The stats are so frustrating and disappointing, and the impact that bullying has on everyone, but in particular people with autism, given the rates, is really, really heartbreaking. If only we could cure the bully, I think we'd be in a much better place. Yeah. There are a few things that stood out to me there, and I've got a couple of quick questions that I want to pose, and then we've had a couple of questions that I think you've addressed most of them as they've come through the chat. There's a few that were sent to me as well. I did wanted to ask about, or just I guess comment on, at the end, you talked about the importance of life beyond school or life outside of school. And I think that is something that, in my experience, in working with individuals with autism and their family, I certainly have seen the power of that. When you've got somebody who spends their day, the 6 hours a day in school and, maybe a little bit of time before and afterwards, because they're just around the school environment, that are, regular targets of bullies, that is absolutely exhausting. It's completely undermines their self-esteem, self-confidence, all of the things that you've mentioned in your presentation. For them to go home and not to have any other opportunities to connect, any of that fun that you're talking about, those positive social opportunities, that is certainly not helping them. Now, many individuals, when they get home, and I'm like that myself, at the end of a day of work, I want to shut off and I want to just disengage. But I think, what I took away from what you were saying was the importance of making sure that individuals, autism or not, if we suspect that there's bullying there, making sure that there's those opportunities for extracurricular activities, some opportunities for a connection, even that one friend, that one opportunity. I think that's a really, really critical thing for parents to look for. Make sure there's opportunities for their child to connect in with another group, whether it's online or otherwise, some group, some opportunity to develop that friendship. It really does have that opportunity to, help to, I guess, create that social support, that safety net when individuals are being bullied at school. That just really resonated for me, so I wanted to comment on that.
Yeah, I think I'll just say, I remember years ago now, when I was still a student and I was taking my training program and I was doing assessments. I had two kids that I was assessing at the same time, and they both had the exact same initials. And so initially I was like, I'm going to get these two kids confused. And they had both been referred by their parents for an assessment because they were experiencing academic challenges at school. And so it had nothing to do with autism. It was just they had academic difficulties. And I mean, we're talking 10 years ago, I still remember these two kids because they both had almost the exact same assessment results. They both had intact cognitive intellectual functioning, and they both really struggled around reading specifically. Yeah. But one kid refused to do any reading. I said, come read this. He's like, no, not going to do it. And the other kid tried really hard and just couldn't read. And the kid that tried is the kid that's going to be better off, because if you try, at least you can succeed. If you don't try, you can't succeed. And the fact that tended to go one way or the other is the kid who tried, school was a challenge for him. All day long, it was school, 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 trying to build on these skills. But outside of school, he was a provincial motocross champion, and he had a thing he liked and he was good at, and his parents encouraged him. Sure, you work at school during school, evenings and weekends, motocross. Like, you like it, do it. The other kid went to school all day and struggled, went home, and his parents continued to work on school to try and build his skills. He never had an opportunity to be a kid and to enjoy that sort of stuff. And this kid had a positive, healthy outlook and an attempt to try things, and this kid was defeated. And so I took a lesson from that. And every assessment I do, I often focus on, I'll ask parents, what does this kid do for extracurricular activities? Because sure, if I'm doing an assessment, there's an aspect of struggle somewhere. We want to focus on that, but we don't want to put all of our eggs in that basket and not allow this kid to have success in other aspects of their life.
Absolutely, that makes perfect sense. You know, one thing that you know is there's from a research standpoint, as well as just all of the information and the shining the light on autism that the autistic self-advocate groups are doing for us right now. One of the things that's coming to light that we're learning more about is the concept of autistic masking. And masking, if that's a new term for anyone, is really about putting on that I guess neurotypical mask in order to be able to navigate through social situations in the environment more effectively. So in effect, the individual with autism is suppressing their autistic characteristics in order to try to fit in a little bit better. Now, I would imagine that there's going to be a significant link between those who engage in autistic masking and those who are bullied. I bet you those who are bullied do a lot more autistic masking in order to try to get through the day. And what I know the research is showing that autistic masking is also associated with, you know, really poor outcomes. It eats away at your self-esteem. It really it taxes the coping system because you have to be on high alert to manage your presentation day to day. And I'm wondering if you've crossed paths with any research of where those two things have come together. Are people talking about that? And I don't know whether or not you've noticed, is there a link there at all?
Yeah, individually, sure. I mean, everything you said is 100% true. I'm not aware of literature that talks about the overlap between masking, or another term people often use, camouflaging, and the incidence and rate of bullying. But clearly, I think there is going to be an overlap. Part of that will be the success of the masking and whether or not that enables them to be, you know, to get by in a school day effectively without somebody identifying them as a potential victim or not. But again, it's I'm at school. I should be devoting my time to academic development and all the social stuff that goes on in school. I shouldn't be developing all my time dealing with the additional stress that school and that whole environment puts on me. And if I'm putting all of my resources just dealing with life, I can't deal with everything else that school is supposed to provide to me. And so school ends up becoming a toxic environment. So we would hope that we get to a point where there is much more acceptance of individuals so they don't have to mask unless it's something they choose to do, but it becomes a choice as opposed to a requirement just to cope and get by during the day.
Yeah, definitely. I have a feeling the answer to this question, something that was posed in the chat to me, is the answer is probably related to something you've said already. But one of the individuals, one of the attendees had asked, you know, they're in a situation where the school isn't just not dealing with the bullying. So despite the fact that the child is being bullied, the parents have gone to the school's tactic may have been to approach the bully, ask, are you bullying? And the bully denies it. And there's no obvious proof anywhere, particularly when you're talking about more of the emotional bullying or social bullying. You know, that's not going to have the obvious impact that bruises will, that somebody else mentioned. So, you know, I guess I'm wondering if you have any comments or recommendations or thoughts that you'd want to offer around those situations where, you know, the family is trying to, the child and the family are trying to approach the school to deal with it, but the school, I mean, it's they might not be taking it seriously, or there isn't evidence, overt, objective evidence that bullying is happening. It's fine to have a zero tolerance program, but if there's no objective evidence, how does one then protect the child who's being bullied?
Yeah, and this is a complex situation because from the school's perspective, it becomes the they said situation, right? And
Yeah.
you have a situation where even if the student discloses to somebody at the school that this is happening, even if there's bruises, like there's physical evidence, depending upon the approach and the tact the school has, they can exacerbate, they can make it worse. So they go and ask the person, are you picking on him? And he goes, no, but I'm going to do it a lot more now, because that is an approach tactic, but it's not the most effective approach tactic. And so there are particular strategies put in place where they don't point a finger at the bully and ask if. They bring the bully and the victim together. If it's in the same room, great. If that can't happen because the victim isn't comfortable with that sort of situation, then it tends to be an attempt to engage in collaborative problem solving so that there's a shared mutual understanding, or at least an understanding from the perpetrator's perspective that that sort of behavior will no longer be tolerated. I think the thing that was described in the chat is physical bullying, about there's bruises and that stuff going on. The challenge is when the greater challenge is when that transitions to social bullying or more covert bullying. So at some point in time, there's going to be no more bruises. It's all going to be electronic or social or cyber, and the school can't do anything about it, because if I send somebody a text, I can walk across the street and send a text, and the school has no jurisdiction over my behavior anymore. So I mean, that's an even greater problem I find, is the school can only control what happens within their parameter, within their geography. And students leave that geography but still engage in bullying.
Well, it raises for me a question that actually somebody else asked first, but it was about the current COVID situation, and I think the impact that it's going to have on all of the virtual schools, of virtual learning that's happening right now. We know that many individuals with autism have a big online presence. They're engaged in gaming. They're engaged in different whether it be chats or advocacy groups. Lots of online stuff. Now the school is online. I think we run the risk of there being, as you say, it's less observable, that it's not like out on the playground you can see the bullying happening. Now things are happening in cyberspace, on the internet. And so I think that I guess it sounds to me like there could be more of an increase in bullying, particularly this online bullying, as we go forward, because we're spending so much more time behind the safety of our computer screens. And I don't know whether
the anonymity of our computer screens.
Yeah, the anonymity of it, right? And I think that it might even be more difficult then to prove, is that was that bullying happening during school time or not school time? I mean, I don't know. I mean, at this point now we can get into that. Can you trace the time that the text was sent? Was it during school time? But I think the idea of now we're setting up a situation because of COVID that I think more virtual bullying could happen.
Absolutely. Yeah. And I think effective policies around this are going to be ones that don't set artificial parameters around the timing. I mean, in a school situation, it would be a location, but in a virtual environment, it would be the timing of it. Like if it happens during school hours, we could do something about it. If it happens at 3:01, we can't. If it happens on school property, we can. If it happens across the street, we can't. I mean, effective policies need to transcend some of those barriers, those boundaries that are arbitrary, and kind of say that if one student engage in this behavior on another student, regardless of where they are physically or the medium with which it happens, this is not negotiable. Yeah. So that is going to be an expansion of policies that I think will have to happen. Otherwise, kids find loopholes and then they work the system. The system needs to be just as sophisticated as they are.
Yeah, indeed. I wonder, like, given the prevalence of bullying in autism, just bullying in general, but bullying in autism, what strategies or how would you recommend parents start the conversation with their kids about bullying, asking, are you being bullied? What does it look like? What would you, and again, this is wearing your psychologist hat, how would you recommend to families that they start having that conversation to investigate if bullying is happening before it gets to a place where we're seeing the more overt symptoms and the more negative impacts that bullying will have over time? How to be
Yeah,
proactive.
I mean, yeah, I might even take my psychologist hat off and just put my parent hat on, right? And so I've got three small kids, one of which is in grade 1 right now, and a lot of his uh, bringing up has been my wife and I are both psychologists, and we both work with different exceptional populations, and so there's been a lot of discussion with him about kids that are different than you, and just because they're different doesn't mean they're less. And so it's a lot of work to try and build up an awareness of acceptance in every kid to begin with, so that they end up becoming more tolerant to begin with. And I distinctly remember growing up that if I ever came home and I or one of my friends said something that was not necessarily nice about another child, that even bordered on like rude or inappropriate, my mom clamped that down right quick. That was not negotiable with my mom, not going to happen. So I grew up in an environment where being intolerant was not tolerated. And parents can help that, not just with the kid on the spectrum, but all parents can help that if they just take that challenge on. I think if your kid's on the spectrum, it's having a similar sort of discussion with them. It's that there are other kids who will accept you and will like you for who you are, and there are other kids that may not. And it's important to know who you could and should be friends with and who you probably shouldn't, because that's one challenge that a lot of kids experience is oftentimes the kids who are not nice are the popular kids. And most people want to be friends with the popular kids. And so these kids aren't nice. And so I do things to try and get into their good graces. And it tends to propagate this continuing situation where I'm trying to be friends with kids that don't want to be friends with me. So trying to help them recognize who could be appropriate sources of friends. And sometimes the popular kids are the mean ones. We don't want to be their friends. Of course, a lot of kids don't understand that until you get a little bit older, but we could try and build that awareness up. I think that trying to get, talking every day around the dinner table, we always sit down, and we tend to start with our middle child because he tends to command the attention. It's what happened in your day today. So we'll always sit down, and Alex always says, okay, let's talk about what we did today. Today I did this. And it's just, developing like a culture where we share what happened in our day. And especially if kids are young, they might not know that this is something that they might want to keep to themselves. Well, today so-and-so hit me on the playground. I go, oh, really? That's an opportunity for us to try and get some insight around that. As kids get older, they start to hide some of that information, but especially when they're younger, they might be more forthcoming with that. And then that's an opportunity for us to try and support them through that sort of thing. And then if that kind of disclosure ever happens, it's really important that parents don't react negatively to it, but are very thankful for the honesty. That way they set up a situation where kids feel like they can trust parents. And then parents also need to give thought to what they should do with that information, because if they then go to the school and go to the kid and start trying to solve the situation, the child who's the victim actually isn't learning to solve the problem for themselves. They aren't developing a new skill. And at some point in time in their life, they're going to have to solve their own problems. And so there's the thing that I put in the chat box around a lot of parents try and helicopter parent and try and get their kids to avoid any potential challenge in their life because they don't want their kids to experience challenge. But the problem is kids can't develop coping strategies if they don't experience challenge. We don't want them to experience challenge that overwhelms them, but kids have to experience stressors and challenge in their life, or they'll never learn to develop those skills. They just have to experience it healthily and be supported to develop those mechanisms. So very ironically, and I know that it's a triggering topic, there was another student in our program a couple of years ago whose thesis was on the positives of bullying. And the things that bullying can actually bring about. It was a very controversial topic, to say the least.
Indeed.
But it stimulates problem solving in people that have the skills to work their way through it. So I don't think I answered the question directly, but
No, I think that there's lots of gems there. So no, that was good. One of the things that we chat with many of our clients and participants at the Sneed Family Foundation about is that they've had difficulties with their friend networks at school, with classmates, in the workforce, a variety of situations where, because of some of the characteristics of autism, speaking very kind of bluntly to people, right? Sometimes, the filter isn't is filtery as what, that we common see, like sort of what the social norms are in our society. For a number of different reasons associated with those autistic characteristics, oftentimes the individual engaging with the person with autism will claim that they're being bullied by the person with autism, when there's no intention to bully whatsoever. It's purely just an artifact of a different style of communication. And I think that that's a piece, that's a new domain for many folks to think about, because how do we want to always treat bullying seriously. We don't want to view autism as it's not, there's no intention to view autism as a disability. It's not a problem. It needs to be, as we mentioned earlier, by Autism Speaks, conversation about needing to cure autism. There's nothing there to cure, but it's a different way that the brain processes information. And because of that, there's going to be differences in communication style. As a result of that, there's going to be some of those communications gone awry. And if other people are now, or if they are at risk of misinterpreting the conversation and feeling bullied by the person with autism when bullying didn't happen, that's getting some of our folks into trouble at school and in the workplace, when really there was no traditional bullying happening. Like, it wasn't, by all definitions, bullying did not take place, but that other person was feeling bullied by the person with autism. And that's an unfortunate, I think, outcome that is, maybe unavoidable, but we're seeing more and more of that.
Yeah, and I think, I mean, quite clearly there are situations where, that more blunt, direct, communicative approach can serve people well, and sometimes it doesn't. And I think it invites an opportunity to become aware that there isn't the intention to harm necessarily. There could, but not all circumstances is there intention to harm. It could be perceived that way, but that's where there has to be a discussion around that sort of thing, instead of just an assumption. Right, it's an opportunity to try and work through that. I remember years ago when we were doing one of our social intervention programs, there was a person in our group who had a crush on somebody else they were going to school with, and so awkwardly was trying to approach that person to try and let them know they were interested, to try and ask them out. And the tact with which they did that wasn't perceived appropriate, and so there was a charge filed against that person and a restraining order put in place, and all because of an awkward approach to try and let you know, I'm kind of crushing on you. It was a misunderstanding, and of the method with which somebody was trying to communicate that sort of thing, and it led to a very negative experience, and it entirely could have been addressed with a more open conversation. And that's something that I think a lot of people need to work with, is understanding that some people communicate and engage differently, and it doesn't mean that it's wrong or that it's intentional. Sometimes it is, but you need to have a discussion around that sort of thing. You need to approach as opposed to avoid.
Absolutely. There's one other question about how would you recommend teachers have a conversation with their students about bullying in the classroom? I'm wondering if you can comment on that.
I think I would ask the specifics of what the question is looking for. Based upon my initial thoughts, it would be, I don't think that having a discussion about bullying and autism in the classroom is going to be overly effective, because all that does is highlight one or two kids in that classroom, and at the same time isolate and ignore all the other kids in the classroom that could potentially be victims of bullying as well. So it's having a more blanket discussion about what bullying is and how and why, what we could and should do about it, and to try and make sure that it's a whole group thing, as opposed to don't pick on Johnny. You don't want to do that, because guaranteed, as soon as you say don't pick on Johnny, Johnny's getting picked on. You don't want to isolate or target. You want to try and have it more blanketed like that. And then moving forward, if situations happen, then it becomes a unique, specific circumstance, as opposed to targeting the child directly.
Yeah, that makes perfect sense. One of the things that, questions that are coming up in the chat to all attendees as well as to me are questions about, when the school is not taking it seriously. And so you did address earlier, kind of moving up the chain, talking to, administrators, talking to your superintendents, trustees, and, it's unfortunate that I think we're in a place where so many of us, just as a society, are are avoiding rather than approaching the subject. Not really sure how to respond to it. I did have a question it's a pretty specific question about whether or not you've got any data that speaks to, or you've seen any data that speaks to how we know that and I remember this from a long time ago, and I don't know the bullying research very well. This is your domain, not mine. But there's differences, or there tends to be differences in the ways between which males versus females will use bullying, right? Males are more likely to use physical aggression, females more likely to use more social, emotional, relational aggression stuff. Given gender diversity differences in autism versus the typical population, whatever typical is, are we seeing similar trends in the kinds of strategies that that individuals, say male or female or non-binary, may use, and or what they're experiencing when people with autism are engaging in bullying?
Yeah, I don't think the literature has gone down that pathway yet. I do know that yes, boys tend to engage in more physical, but only in the early grades. And once you get to like grade 3-ish and up, kids start to realize that if I hit, punch, or kick, the teachers can see it and I can get into trouble. So they stop doing it and start to engage in the covert forms of bullying, whereas girls just tend to not engage in the physical to begin with as often. So there is a much quicker and a rapid progression towards those covert forms of bullying, because it's just as effective in what the intention behind the behavior is, with less visibility. So that understanding has emerged over the past couple of years, that physical bullying doesn't happen anywhere near as often as it used to, even not all that long ago, because especially with the proliferation of online technology and all this sort of stuff here, is that I can't hit you if I wanted to, but I can sure do other stuff because of the methodology with which we now are kind of forced to interact, right? So when it comes to gender diversity within there, I mean, there's a lot of literature looking at gender diversity and autism, but not necessarily the intersection between gender diversity, autism, and victimization. I would say predominantly, if you're talking about people on the spectrum, and whether or not a born male as opposed to a born female, as opposed to an identified male or an identified female, experiences different forms of bullying. I don't think that's gotten anywhere yet, other than to say that people on the spectrum tend to experience higher rates of victimization. People who are LGBTQ, gender diverse, anything within that kind of range also experience greater rate of victimization. And if you've got both, you are classically intersecting across all of that. So there's going to be a high rate of that sort of stuff. And it's assuredly, by the time the most individuals who do not identify with the gender binary realize that and start to express their gender however they uniquely want to, they're typically not within those very early grades. That typically starts to emerge as they get a little bit older and start to understand their gender and kind of who they are and feel more comfortable expressing. By the time you get to that stage in development, most of the bullying is going to be more covert. And so that's where you're going to see a lot of rumor spreading, a lot of lies, a lot of electronic type stuff. It's going to be all of that. You're not going to see a lot of the physical stuff.
Something that is, I think I'm taking away from all of this conversation is the importance of having these conversations early with kids, with students, parents approaching it in a very open, as a matter of fact way, a conversation around the dining room table, or, whenever. And I think that if we can, as a group, as a culture, as society, start having these conversations earlier and earlier, I think we're going to be much better positioned to be able to reduce the frequency of bullying and help to kind of build our kids' resilience and their coping skills to bullying that does happen, that is unfortunately unavoidable.
I remember one of the strategies that we learned a long time ago. We've got 3 kids, and the older 2, Zach and Alex, when they get along, and life is great. And when they don't get along, our entire household is chaos. And the one thing that we have learned, that we got advice around, is it's one thing to tell one of them not to do it, because they'll listen to you until you turn your back and then they're going to do it again. What is more effective is letting him know why not to do it, that you're hurting his feelings. Like you know that when he did that to you, how you felt. Well, you doing it to him makes him feel the same way. It's trying to develop that empathy for somebody else because you've had that experience. They're also sharing that experience. And over time, what we're seeing is they're starting to understand that when I do this, it makes you feel the same way that when you do it to me. So I don't want to do it to you because I don't want you to. And they start to understand it's a relational thing. Yeah. They now have other ways they're trying to, and they're 6 and 4, so they're always trying to one up each other. It's nonstop trying to see who's higher in the social hierarchy, and it evolves over time. And they're getting better. They're young and they have to develop those skills, right? But we are helping them by building a lot of that empathy, that shared understanding, and that collaborative problem solving. Now it's no longer I want that toy. It's okay. I want the toy. What do we have to do in order to figure it out? And sometimes they're successful at talking it out, sometimes not. But that's a lot better than a year ago when they were never successful. Right?
It's an interesting question that was just posed. How would you approach talking to a child who's a victim of bullying by someone on the spectrum?
Yeah. So I would first try and get details to find out if it actually is bullying as opposed to a misunderstanding, as opposed to a one-off incident. Like, does it seem, is it repeated? Is it intentional? That sort of stuff. If it is, I would say that the fact that the perpetrator is on the spectrum should have little impact. You would still want to deal with it the same way. As just because somebody's on the spectrum shouldn't mean that there are exceptions to the rules, that they're held to different standards, that there is expectations for how we interact with people. I think the challenge is a lot of people might approach this, rightly or wrongly, with a point of that the perpetrator in this particular situation doesn't know that what they're doing is incorrect behavior. And that could be the case, in which case, through a discussion and through a process of understanding, we can learn, okay, now we need to try and figure out how we can try and get this behavior to change because of the lack of awareness on one person's part. But I don't think we should go into a situation assuming that people on the spectrum are blissfully ignorant and unaware of the impact of their behavior on others. They certainly can be, and often are. So, you know, and it's trying to get them to understand that their behavior has impact on other people. And there's a lot of people incorrectly believe that people on the spectrum don't understand emotions of other people. There's a ton of literature to show that they can be very empathetic. In fact, a lot of self-advocates describe them being overly empathic towards the emotions of other people. And so if you can try and bridge that gap towards getting them to understand that what they're doing is helping them but harming somebody else, what else could we do in order to try and get the same sort of purpose behind the behavior? It's all a problem-solving strategy.
Absolutely.
Why are you bullying? What is it that you're trying to get through the situation? Okay, what else can we do to help you get there? And trying to replace behaviors.
No, absolutely. Great. Well, it looks like we've gone through all of the questions in the chat, and you've shared your thoughts on a bunch of the other comments and questions that I have posed. I'll like to thank you very much for your time tonight, Adam. Fantastic presentation, and I think it's probably left us all with, you know, this feeling that we need to go away and you know, change the world by trying to impact the teachers, impact our kids, do as much as we possibly can to you know, build their coping skills, as well as try to do what we can to stop the bullying from happening. So thank you very much for your time. Anyone, if people do have questions for Adam, you can find Adam at the U of C at the CERT lab. Adam has an online presence there. You can hunt him down and stalk him through his U of C. If you have any questions about any other community resources, whether it be bullying related or otherwise, please feel free to reach out to us at the Seneve Family Foundation. You can contact us at info@senevefoundation.org. We've got parent ambassadors, as Kate is, the person who introduced this presentation, would be happy to help navigate you to any resources that you might be interested in the community. Thank you everyone for sticking with us tonight, for spending your night here with us. And again, thanks Adam for giving us your time and all this information. Hope everyone has a wonderful evening and stay warm.